ethos.
Early to bed, early to rise makes a man healthy, wealthy, and wise. Ben Franklin, he makes it sound all too easy, doesn't he? But of course, life is never that easy, and it's a lot more complicated today than it was 300 years ago when Ben Franklin was alive. Now we receive more information in a day than he did all year. Do you think that makes us any healthier, wealthier, and wise? We're certainly wealthier by material standards, but I think if you're honest, don't you want to be healthier, wealthier, and wiser than you are today? Where to start? Well, you start right where you are. Take the next step. I'm Paul Goldsmith, a creative coach and entrepreneur, and you're listening to the Creative Coach Cast. I love how Greg McKeown puts it in his book, Essentialism, the Disciplined Pursuit of Less. He writes, if we underinvest in ourselves, our minds, bodies, and spirits, we damage the tool we need to make our highest contribution. He calls this protecting the asset, to use a financial term. You are the asset, and people who protect themselves, they're able to go about their daily lives with a reserve of creativity, energy, and problem-solving ability to call upon when needed. How wonderful does that sound? What's it going to take to be the healthiest version of yourself? I'm embarrassed to admit it took a global pandemic to wake me up to do just that. For you, the next simple step may be finding an expert in the area that you want to grow. If it's taking care of your health so that you can have more energy or have clearer thinking, the shortcut is really finding people that can help. I wanted to invite someone on that could maybe help us figure out what the next step in being proactive with our health is. And so let's welcome Julie Thomas is an advanced practice nurse and co-founder of FYI Health. Julie, what does it look like to get proactive with our health?
A big part of it is time. So much time. If somebody has a question or they need help from a medical provider, it takes a lot of time to make an appointment if you can get one in a timely manner. You take time off work or time away from your family to go sit in a waiting room where there are other people there. And now during the time of a pandemic, that heightens a lot of fears too. So it's all about balance, and how we get care is a part of that equation.
I like that. We could all use more balance and healthcare on our own terms. And so you have a physical location, a medical practice in Nashville, Tennessee, but you have clients and patients across the country. So if folks can't or don't want to meet with you in person, they can call a phone number. And if it's not you personally, you're backed up by this other telehealth system, right? So you get kind of the best of both worlds. There's an actual office location, but you can also call in from anywhere.
You can just pick up the phone and not have to look at a person, which is nice for a lot of people. Sometimes when a lot of women, if they have sexual health concerns or issues, same with men, it's really embarrassing to sit in a room and look at somebody in the face and ask and think, oh my gosh, I'm going to have to see that person again. Where the beauty of this is it can travel with you wherever you go. If you're on vacation with your family, anywhere in the United States, you can pick up the phone and call and get a prescription if you need one for whatever issue that you might have. But a lot of men don't seek health care just because they're embarrassed. And so if we can take away that having to show up, sign in, tell the front desk person, and nobody has to see their face, then they might be much more likely to call, and therefore it will impact their personal relationships.
That's powerful. I think about, as a guy, only going to the doctor when it's an extreme need, if I break my leg. And so I like to think about it as, rather than just, our modern healthcare system seems more like sick care, when we only go when we really have to, when we're at death's door. And I think you approach it a little bit differently. Tell us about that, like true healthcare. What does that look like?
So healthcare in America, you're exactly right. It's an entire system that is based on diagnosing and reacting to disease. That's how the whole insurance model is set up. That's what insurance pays for. If you have a complaint, you go to the doctor. They code it in a certain way to get your insurance to pay for it. If it's wellness minded, there's no really payable code for that. They don't really react to that and they don't respond. They don't care. So the wellness piece is missing in healthcare.
There's no code for that. So then what is the solution for someone seeking true healthcare?
The solution isn't necessarily in a doctor's office. You know, it might be that you need more time with your family. And it might be that instead of waiting 2 weeks or more. It's getting longer and longer for a lot of people to get in to see who they need to see. But instead of waiting to get your questions answered and taking time away from carpooling your kids to sporting events and cheering them on the sidelines at a basketball game, you're able to schedule this appointment, and the average callback time is 12 minutes. And so you can get your question answered and go on with your life. And most people don't realize that 70% of calls, healthcare related calls, can be handled over the phone. Instead, they go to the ER or an urgent care, which is expensive. Most people have a high deductible plan now. And so you're getting into the financial stress of how much is this going to cost me to get this care, and how much time is it going to take? And am I going to be able to afford that? And my deductible is $5,000 for my family. Well, I haven't met it yet. So an average ER visit is $1,400. So if you go there for a urinary tract infection or an urgent care, $200 is a lot to a lot of people.
Yes. And what I've discovered since becoming an entrepreneur and starting my own company is there's a marketplace. You can buy your own catastrophic insurance policy for when you break your leg or have a heart attack, one of those unexpected events. But for the day-to-day health, there's some great options like FYI Health, where you can do the monthly membership and not have to deal with insurance and copays and all those different things. I really believe that this is helping people get healthier and reducing stress and just giving them options. I'm all about options. And you have Netflixed the medical industry. I love that.
We have Netflixed the medical model as best as we could. Some things you just need to be seen for, but a lot of it you don't. You can talk to somebody on the phone. So for a monthly fee, each person in the membership can get 4 urgent care visits a month, whether or not they choose to use them. And they also get 5 mental health counseling sessions a month, whether or not they choose to use them. And there is no per call fee and no insurance hassle.
Do you see a commonality of the people that you see? What is one thing that you would tell women or men that would maybe help them be more proactive with their healthcare rather than reactive? Maybe what's one simple step or something that, when the light bulb goes off, it changes everything?
Some people who might struggle with their weight, they don't want to go to the doctor to step on a scale and be told in a 15-minute visit that they need to completely redesign their entire lives. Plus, here's a prescription for cholesterol medication and blood pressure medication, and I'll see you next year, or I'll see you in 6 months. At least this way, people can be offered other things, and we can partner with other companies, wellness companies like plant-based chefs, for people to pick and choose where they would like to grow personally, because it's their story and it's their choice. And so somebody might be like, deep down, they really know what they need to address. If it is a relationship with another person, or if it is a relationship with themselves, or if it is a relationship with food or exercise or any of that, because we're all intellectual, emotional, spiritual, physical, relational human beings, and they all require intentionality. And so to try to tackle all of those things at one time is overwhelming for most people. I would dare say for anybody. But if something is broken in a particular person's life, as a provider, I can tell them how it's showing up in their physical body and give them tools or options. And so what we're trying to do is create a collaboration with other wellness businesses where we can offer to our members information, offers, discounts, meal plans, blogs, anything to equip them to live their best life in balance. And they can pick and choose what they need based on where they know they are in life. It's kind of like me showing up, and if you were my provider and meeting you for the first time, I can try to give you a detailed sketch as I can about what's going on, and you can help me as best as you can. But I'm living 364 days without you kind of by my side. And so we really just want to offer and equip is what we want to do without telling people what to do.
That's powerful. If this sounds interesting to you and you'd like to talk to Julie or one of the other professionals through FYI Health, your website is fyi.health. And you've been so gracious to offer a promo code. So if you want to check it out, if you put in the promo code COACH, for a single person signing up, it's $159.90 a year. Or for the family, it's $249.90 a year. That's remarkable. This is a great option to have. So thank you so much for what you're doing. And like I said, if anybody wants to check you out, they can go to FYI.health and learn more. So thank you so much for what you do.
Thank you, Paul, very much.
And thank you so much for listening. I hope this has been helpful. And if you're looking for help figuring out your next simple step of being the healthiest version of yourself and creating the things that inspire you, reach out. You can text me at 559-574-3210. I'll talk to you next time.